So let's talk about Paget's disease of the bone. And so it occurs because of the dysfunction of the osteoclasts. Osteoclasts are the cells that eat the bones. So these are like bone eating cells, and so they're kind of like derived from the macrophage lineage. And macrophages kind of eat the bacterial cells, which is called phagocytosis. In a similar way, osteoclasts are cells that are in the bones, and they kind of eat the bone, and that is important for bone regulation. But when they are dysfunction, as in Paget's disease of the bone, this results in increased bone turnover, and so this results in all of the problems that occur in the Paget's disease of the bone. And so it occurs mainly in three phases. So first is the osteolytic phase. So in the osteolytic phase, what happens is that the osteoclasts are kind of activated, and it results in increased activity of the osteoclasts, and they kind of start eating the bones. And these are the cavities that are formed in the cells. And these green here are the osteoclasts, and they're eating the cells and resulting in cavities. So this was the osteolytic phase. The second phase is mixed lytic and blastic phase, and so in here, these purple here, these are the osteoblasts. The osteoblast kind of comes into play, and they kind of result in formation of bone. On this yellow is just bone or sclerosis. So that is the mixed lytic and the blastic phase. Here both the osteoclasts and the osteoblasts kind of like act together. And so then we have the osteoclasts, and then the third phase is the osteoblastic phase. And so in this phase, the osteoclast activity kind of slowed down, and mainly we get the osteoblast activity, and there is increased sclerosis and bone formation, and this results in all of the problems that we're going to discuss next. So the prevalence of Paget's disease of the bone is that it is the second most common bone disease. Remember, the first most common bone disease is osteoporosis, and so the prevalence here is that it occurs in 3% adults age greater than 40. So that's significant. So it is the second most common bone disease. So coming to the clinical features, it's usually asymptomatic. It's most commonly just asymptomatic, but if symptoms do occur, it usually affects the skull, the spine, and the long bones. So let's talk first about the skull. And so in the skull, it can result in, as it increases the bone formation, there's increased bone formation. It results in increased head size, so the skull size kind of increases, and this results in increased head size. Another thing is hearing loss, and the reason for that is because you see there are phenomena. So if this is a skull, let's say this is a skull, then in the skull, from the skull there are phenomena, and through the phenomena, if this is for example, this is the brain, and this is the nerve that is arising from the brain, it comes out of the skull through phenomena. And in what happens in Paget's disease of the bone is that there is increased bone growth. And when there is increased bone growth, it can compress this nerve in the foramina because of the narrowing of the foramina, and that results in various manifestations. For example, the hearing loss, because it can result in increased bone formation in the petrostemporal bone, in the internal auditory canal, and that can compress the cochlea or the eighth cranial nerve, and that would result in hearing loss. So that's the first thing. Then number second is that it can affect the spine, and in the spine it can result in spinal stenosis. And so what happens there is that if this is let's say this is the spinal cord, and around it are the vertebra, and the vertebra can increase growth in the vertebra can compress the spinal cord, and so when a person kind of it can result in spinal stenosis. And in spinal stenosis, it is also called pseudoclaudication, because it's not a true claudication which occur in the vascular disease. So it happens when the person when the person flexes, then it relieves the compression. And for example, when a patient is kind of on a shopping cart, and it leans over the shopping cart, then it kind of results in relief of that or relief of the symptoms. And when the patient kind of or the person kind of gets away or extends the spine, then it results in aggravation of the symptoms. And so similarly, when the person is climbing up, it results in flexion of the spine, and that results in relief of the symptoms. So when a patient is climbing down, then it will result in increased symptoms. So it is also called shopping cart sign for the obvious reasons that we talked about. So while so pseudoclaudication is a phenomenon that is associated with the spinal stenosis that we talked about. So because when a patient kind of stands, the pain will occur even when the patient is standing. While in claudication, the true claudication, the pain will not occur when the patient is just standing. When the patient walks or when there is an exertion, then the pain occurs. While in the spinal stenosis, the pain can occur even when the patient is just standing. So that's one difference to help you differentiate between the pseudoclaudication and the true claudication, which the true claudication occur in the vascular disease, while the pseudoclaudication occur in a bone disease. So then we come down to the long bones. So in the long bones, it can result in fractures. It can result in arthritis and fractures and bone pain, all of those kind of things. So then in long-term complications there are two tumors that are associated with it. The first is the giant cell tumor, and the other is osteosarcoma. So these are two tumors. So now coming down to the diagnosis. So how do you diagnose this? Mostly it's asymptomatic. So usually the patient will come for something else, and on the lab there will be incidental finding of isolated elevated alkaline phosphatase. So it is actually the most common cause of isolated elevated alkaline phosphatase in older patients. And so when you see that, and all the other labs like keratodermal phosphorus are normal, then you should think about Paget's disease, because it's usually incidental finding, and the patient comes for some other thing, and then you diagnose him with Paget's disease because of the increased alk phos, isolated increased alk phos. Then another thing that can be present in Paget's disease is increased urine hydroxyproline, and the reason for that is because hydroxyproline is a breakdown product of collagen, so it's actually a marker of increased bone turnover, which occurs in the Paget's disease. Then on bone scan, there will be increased focal uptake. So increased focal uptake on bone scan. That's another finding in the Paget's disease. Then the last thing was coming down to the treatment. The treatment is bisphosphonates, and the reason for that is because for example, zoledronate and all of those kind of bisphosphonates. So bisphosphonates kind of helps, they inhibit osteoclasts, and we know that Paget's disease is osteoclast dysfunction disease, and so it results in apoptosis of the osteoclast, and so that is why bisphosphonates are helpful. So I hope this was helpful.